In this video, we're going to look at why some hamstring strains bruise and others don't. Why the bruise is often lower down the leg than the actual pain point. And what you can do to get rid of the bruise. My name is Shachar. I'm a member of the Exakt Health team. Our mission at Exakt Health is to make quality injury treatment available to everyone. The link to the Exakt Health app is right down here in the video description. It's a free app offering evidence-based treatment plans for the most common running injuries, such as hamstring strains. Let's get into a quick recap of the anatomy of a pulled hamstring. Thousands of muscle cells are grouped together in bundles that make up the fleshy part of the hamstring muscles. The bundled cells are held together by fascia, that thin, opaque white sheet you see in meat. A single muscle contains numerous bundles, and the muscle is also covered by a layer of fascia. Blood vessels penetrate the fascial layer, and they divide until they are tiny enough to supply oxygen and nutrients to every single cell. Now, when you pull or strain a hamstring, you tear some of the muscle fibers, the fascia, and some blood vessels. Let's get into why some hamstring strains bruise and others don't, shall we? A bruise, simply put, is an accumulation of dead or old blood under the skin. It forms whenever you injure a blood vessel, but you'll only see it if the blood can rise to the skin. Often it can take a few days. Then, for the bruise to disappear, the body must absorb the dead blood and remove it via the lymph system. Whether you see the bruise from a pulled hamstring or not will depend on several factors. 1. The size of the blood vessels. If the blood vessels you injure are tiny, there will be very little bleeding, and it will stop quickly, so it's not likely that you'll see much bruising. 2. The fascia sheath. Sometimes a significant blood vessel may tear, but the bleeding will be contained by the fascia sheath surrounding the muscle. The blood may not be able to rise to the skin and remain deeper in the muscle until absorption. The immediate post-injury measures you take affect the bruising as well. If you stop your activity immediately and follow the Price treatment regime, you will limit the bleeding and bruise less. If, however, you continue your activity, you are likely to bruise more. Certain substances like alcohol or aspirin can act as blood thinners and result in increased bleeding. Often, a pulled hamstring will bruise further down the leg, around the knee or the calf. It's simply because gravity can pull the old blood down towards the floor. Let's discuss getting rid of the bruise from a pulled hamstring. Most bruises will disappear within 14 days on their own. As it dissipates, the color turns from deep purple to green and finally yellow. Getting rid of the bruise won't make your injury heal faster, so our advice is don't worry about it too much. So far, the research has not revealed a specifically super effective remedy. There is some evidence that applying a 20% arnica solution may be beneficial. Solutions of 10% or less do not seem to work. Some professionals believe that kinesiology tape will improve lymph drainage, which can improve how quickly your body can get rid of the waste products, like dead blood. Here at Exakt Health, we are not aware of any research studies that prove this, but there is some real-life evidence that suggests that it may be worth a try. Some people use contrast therapy, the practice of alternating between applying heat and cold to the injured area, to increase the blood flow and remove dead blood faster. Again, there's no sufficient research to support or refute this method. However, please do not use contrast therapy in the first 72 hours after pulling your hamstring, as it can increase the bleeding and bruising. The injury needs time to settle. Thank you so much for watching, and keep in mind that you're welcome to head over to the video description and download the free Exakt Health app and begin your treatment with our hamstring strain recovery plan.